Turn it on.
Glenn, Angel, and the Flying Dutchman.
The Big Show on Kiss 92.
Good morning, Singapore, and welcome to Good Morning Doctor. And this morning, we welcome to the show Dr. Quah Hak Mien, a general and colorectal surgeon from Gleneagles Hospital. And today, we are going to be talking about hemorrhoids.
Yes. I love how you make that sound so happy.
So happy.
Yeah, thanks for having me.
Thank you for joining us.
Good to see you again, Doctor.
Yeah, good to see you.
When was the last time we saw?
5 years ago,
5 years. Wow.
we
That's a
were
long
hanging
time.
out with Dr. Quah.
It's a long time. Hemorrhoids. Piles. Same thing? Different.
Yes. Hemorrhoids is just the medical term for piles. Yes.
Okay.
But is piles an official term?
Yes, it is.
But why piles, though?
Yeah, how did it come about?
Because some people were asking me, like, okay, why piles?
Why do you call it
Someone's
piles?
P-I-L-E-S, piles.
Actually, I've not thought about this question before. But all of us, in a way, have some kind of piles because they are actually natural anatomical structures.
Oh.
They are just basically some swollen and engorged veins at the bottom end.
Yeah.
You can say is the because our anus is like the valve, the open and close that keeps our inside, and if we need to let go, we relax the anus, and we let our stools out.
Right.
Okay.
So it needs to provide a good seal. So piles or hemorrhoids are actually the rubber part of the seal.
Oh.
It provides the final sealing.
I see.
That's a great way to describe it.
Then,
But
yeah. Okay, go ahead.
I was going to say, because why do some piles happen on the inside while some happen on the outside? Because that's internal and external piles, right?
Yes. When things go wrong, when the piles start to get problems, get inflamed, then it starts from the inside first. They get more and more swollen, and when they get too swollen and inflamed, then they'll start to prolapse out.
Prolapse,
Yeah.
right? Okay. Okay.
So painful. I had like internal piles about maybe 20 years ago.
Oh dear.
It was the most painful thing ever. I mean, at that time, my uncle was, because my uncle is a GP, you see. So, I mean, he was explaining to me and all that.
What
and,
was
when a
happening, yeah.
relative explains to you, you feel more, more comfortable in that sense.
Yeah.
I had no idea what it was. It's like, wow, what's happening? It's so painful. And I found out that it was probably because I was also that particular week a bit constipated.
Yes.
So then I was
The pressure.
straining a little bit when that happened.
Yeah.
What about external piles, doctor? Is it due to the fact that when someone goes to the loo and takes a dump, he doesn't clean or she doesn't clean up properly?
No. Constipation is one of the common cause of piles. It's not due to cleaning. Yeah.
It's not a hygiene issue. at
But
all.
of course, when the piles are prolapsed, they are inflamed, they are very sensitive, and if you are very rigorous in your cleaning, you can cause more friction, more abrasion, and traumatize them further. Then that can, of course, aggravate things.
That means it was just a lesson from my mom when I was growing up. She was always like, okay, after you take a dump, you clean your backside properly and go wash your ass. If not, you'll get piles. Thanks, Mom.
And now you know. When we come back, I've got a question for the doctor.
Now you know you don't have to wash your ass.
Oh, ew, gross. Yeah, disgusting.
All right, speaking of asses, here's Body Moving by Eliza Rose on Kiss 92.
I think when it comes to piles and hemorrhoids, we all naturally think of pain. That's the first thing that comes to mind. But what other symptoms are there that would trigger us to think we've got hemorrhoids?
It can also cause bleeding, which is also a common symptom. Some people describe the pain differently. They may describe it as a burning sensation. Yeah. Or
Throbbing as well.
yeah,
Some people get
as well.
throbbing.
It
Yeah.
get really bad, and when it get prolapsed, you may feel a lump outside. That can be very uncomfortable to sit on. Yeah.
Yeah.
And another symptom that is not so commonly understood is that quite a lot of people feel that after they gone to the loo to poop, they still feel that there's something inside that they can't get rid of it.
Right.
They keep straining, but they can't push it out.
Right.
So that is also a symptom of piles.
So it could be the pile that they're feeling, the
correct.
hemorrhoid.
Because
wow.
the piles is swollen, it occupies space inside.
Oh.
And it is attached to the body, of course, so they can never pass it out. Yeah.
Is there a way to prevent hemorrhoids?
Yes.
There is. Okay, tell us.
Definitely. It is to take care of your digestion, prevent constipation. So, yeah, eat lots of fiber, vegetables and fruits, drink a lot of water.
Okay, so that happened to me about 8 years ago. I had a very, very bad case of hemorrhoids. So bad I could barely walk.
Yes. It
Wow.
can be
And the doctor said I had to go on a liquid diet. So that's when I became vegetarian.
I see.
So I was drinking and eating all my soups and my food and everything else just because I couldn't digest anything else.
Right.
You know, it was so bad. But yeah, it's better now. But it was a really
Yeah.
bad thing. And women go through it a lot.
Yes.
The pregnant women.
Yeah, pregnancy, the hormonal changes can, and also the delivery process can also
The weight.
aggravate piles. Yes.
Yeah.
You were mentioning consuming fiber, but fiber is not the easiest thing to digest in the first place, right?
Fiber helps us form the make bulk for the stools.
Okay.
So they are a bit more shaped and easier for us to propel it out.
Right.
But too much fiber is no good as well.
Yeah, everything is a balance. So
Yeah.
we need all the nutrients. We also need fiber.
But this is the problem with people, you see. You tell them fiber today, now everyone
Everybody
who's
will go,
listening,
yes.
if we didn't, include that disclaimer there, everyone will go out there and overdo it.
Yeah.
Yeah.
Am I right to say that when it comes to things like vegetables and fruits, people want to get that fiber in, it's best to drink it or eat it? Like in terms of what I do in my soups now is that I blend everything down. I don't eat like chunky vegetables.
Oh, you're like a baby.
Yeah, almost like puree. Yeah, but I blend everything down because I still want to know that I'm getting my fiber without it being not siphoned out, filtered out.
Right.
You know,
Yeah.
is that a good idea?
It is up to you.
Okay.
Even when you mince it or you puree it, it'll still be there'll still be fiber. There'll still be the structure.
Oh,
it'll still
right.
help.
Okay.
Yes.
So it's not
And
about the chewing.
we all of us should chew well to break it down to smaller pieces to help the digestion process.
Okay.
But swallowing, I mean, some people do swallow it whole, but
Yeah.
our body, our intestine will break it down anyway.
Oh, right. Okay.
It's quite an efficient machine.
Okay.
You know, these days when I'm constipated, you know what is my
Prune juice.
huh?
Prune juice.
Not prune juice. Papaya, right?
Papaya.
Yeah, either I
Papaya.
make a papaya shake with a little bit of milk,
Milk. Yeah.
or I'll just have one papaya, then drink like a mug of milk because I love milk, right?
Yeah.
Wow, it's perfect. Perfect. That's all I need.
Yeah.
Okay.
Papaya, bananas are good. Dragon
Prune
fruit are good.
juice.
Prune
Yeah.
juice good.
Yeah.
Papayas are not so hard also. So I mean,
No,
if you're
that's
not,
true.
Yeah.
you know
Yeah,
what I mean?
I'm not a fan of papaya though. I
Ooh,
don't
I
like
am.
the
You don't like
flavor.
the taste,
No.
eh?
The smell and the taste. Yeah.
I love it.
Yeah, I'm not a fan.
Remember, if you have any questions for our doctor, please leave them on our YouTube channel or on our Facebook. We'll try to answer as many of your questions as we can.
So I have a question. So what are the treatments that are available internally and externally?
The first, of course, is dietary treatment. Okay, we advise people to improve their diet. Many Singaporeans tend to be more meat eaters than fiber. So that's the first step. We have ointments to apply on. We have suppositories.
Preparation H.
Yeah, preparation H can be bought off the counter. Then there are tablets to help heal the hemorrhoids, reduce the inflammation, and reduce the pain. Then of course, if it's very bad, then someone has to consider
Removal.
surgical removal, or in between there's also this treatment called rubber band ligation.
I was about to ask you about
rubber
banding.
band
Yeah.
ligation, yes. So there's something in between for medium type of hemorrhoids or piles or second degree, third degree.
What does that do?
Cuts off the blood flow.
The blood flow. Is that what it is?
Cuts
And
off
then
the
it
pile.
drops off.
Look,
No,
yeah,
no. Cutting is more for surgery.
Okay.
For ligation or rubber band ligation, what we do is we put a rubber band clip at the top of the piles, and this causes a bit of constriction, and the piles will then slowly shrivel up, fibrose, and then they'll fall off.
Wow.
Is that a permanent solution though?
Yeah,
Rubber
for-
banding?
If it works for many people, it can be permanent.
Okay.
Yeah, but of course, the other the other things must come in. They have to
The
also take care
diet
of the
and everything
diet.
else.
Yeah, otherwise it will grow again.
Yeah. Okay. Hold on. We'll go back on air.
Kiss 92 traffic.
On the TPE towards the SLE, at the SLE BKE exit, look out for a vehicle that's having a little bit of trouble. Also on the CTE towards the SLE, after the Ang Mo Kio Avenue 5 exit, a vehicle's broken down there. Wherever you are this morning, stay safe.
Good morning and welcome back to The Big Show and The Big Show TV. Our guest for this morning is General and Colorectal Surgeon from Gleneagles Hospital. We welcome back Dr. Quah Hak Mien.
Question on our Facebook page from Eddie. Eddie says, if the so-called lump becomes painless, right, should we worry, and do we need to seek treatment, or do we just leave it?
I think if at any point someone is not sure, should always seek medical attention, have it checked out, see what's going on. If it's not painful, of course, we worry less. The pulse may be healing and therefore becomes not painful. Yeah. But you see, as doctors, we are also aware that the symptoms of pulse are quite similar to other conditions. For example, bleeding or pain could also be a sign of something else, you see. And in Singapore, the condition that we are most worried about is whether someone has a colon or rectal cancer.
That's what we're going to
Yeah,
ask
because,
as well.
because that one cause bleeding as well, and sometimes it cause pain, and it can also affect the bowel habit. So there's some overlap in the symptoms. We have seen some unfortunate sad situations where someone always think that those symptoms were pulse, and then it's okay to ignore and then delay seeking medical attention.
Oh dear.
So that of course will affect things. Yeah.
Can piles or hemorrhoids become cancer?
Oh no, it doesn't.
It doesn't. Okay, all right.
Yeah.
But the bleeding, like you said, and all that could be a cause of something else.
That's right.
Okay.
So the symptoms are similar, but pulse, it will not become
Okay.
cancer. Yeah.
Okay, that's
And we're talking about the external one, because I mean we're talking about internal, because for some people who are experiencing piles like symptoms, for example, right, and they don't have anything on
the outside.
on the outside, it's mostly inside. So you're saying that some people may think that it's internal piles, but it could be something else.
That's right. That's
I
right.
see, I see. But mainly if it's on the outside, it's very seldom that can turn into cancer, right? An external...
So both internal and external pulse
Do
does
not
become
become cancer.
Yeah,
I see,
yeah.
I see. Okay.
Are there... Oh, let's do a time check first, and then I'll come back and do this.
All right, we'll continue to talk to the doctor on The Big Show TV. It's 8:17.
Kiss 92 Time Check brought
We go for regular checks for colon cancer and things like that. Are there... at the same time, during those checks, can we be checked for hemorrhoids, or is it a separate check?
It can be checked at the same time.
Same time, right?
Yeah,
So we could go for a yearly check, for example.
it is, well, not necessarily go for a yearly check for pulse or hemorrhoids. If someone has bleeding or symptoms or they're worried about, and if they are over 50 years old, then we would want them to think about a more detailed check. For example, that may include a colonoscopy,
Right.
to have a look all the way inside the colon.
Yeah.
Also including have a look at the pulse. And if after the colonoscopy we have examined the entire colon and all is healthy, inside is okay, it's just the pulse, then there's some peace of mind that it's
Yeah.
not something serious.
I think for piles, people will know if they have piles. They don't have to check for piles.
I don't think so.
No,
Do
I think,
people
yeah.
always
If
know?
people
that's
have
the
piles,
thing.
they'll know, right? That there is discomfort.
They
Always, they always know.
But
There's no, like, painless piles.
Like yourself, the very first time we had it, you didn't know what it was.
Yeah, but I felt the pain
yes.
because everybody said check for piles.
But he said there are painless ones as well.
Oh,
Like
there's
Yeah,
painless
sometimes
ones.
it-
Yeah.
there's some painless one that just bleed, for example.
Yeah. Yeah. I was going to say, so when one goes for a colonoscopy, it's usually for polyps and everything else, which is what they tell you on
Yeah.
the the results, right? Do they actually come and tell you, okay, you have a risk of this becoming piles, or you have a couple of piles in you, hemorrhoids in you that are swelled that you may not feel already? Do they tell you that? Or
We check the piles along the way, because the piles are located at the entrance of the anus. So when we put in the telescope inside, that's what colonoscopy is about. We will check the
right away, okay, because that's so important not to block the valve, like you said, right?
Piles will not block the valve. It just creates an uncomfortable feeling there.
Okay.
Yeah.
Okay. All right. Okay.
Okay.
So complicated.
Yes.
Yeah.
Now, I just want to ask you, okay, I don't know. Do you have a dog at home? Do you have dogs?
No.
Don't have.
Don't
Okay,
have, yeah.
Because I mean, I've had dogs for many years, and I send my dog, to the vet sometimes, for the vet to release some glands in
the anal glands.
Yeah, the anal glands. Is that like a dog's version of piles?
I think so. Yes.
It's
animals have piles as well. Yeah.
Right. You know what I'm talking about, right, Angel?
Yes, I do.
Yeah.
Yes, yeah.
And that can be really stinky, man.
I have no idea what it smells like.
Oh, your dog hasn't experienced that. Oh, he's young.
No.
at the
He's gone
moment.
for grooming, so he gets all that done.
Yeah, but one of these days he'll be sitting on your sofa and you'll be wondering, what is this liquid on the sofa?
Oh, God.
It'll be that gland that has burst.
Gosh.
All right.
And it is very stinky, extremely.
Okay, so I found out that the word pile is actually derived from the Latin word pila,
Pila.
which means ball.
Oh.
So maybe that's where it came from. Because it's little sort of veins.
Wouldn't the
in
ball
it.
be the testicle?
No, Glenn.
No, because
we're
it's
talking
like
about
a ball.
Okay.
Angie is asking, and it's interesting, people should know this. How often should we go for colonoscopy, and when should we start?
We should start thinking about it definitely when we reach 50 years old, because the incidence of colon cancer is very high. In fact, in Singapore, you put men and women together, is the number one cancer in Singapore. So from 50 years old onwards. And how often after that, first colonoscopy will depend on the person's health, whether we find any polyps or tumors inside, and whether the person has any family background of colon cancer or rectal cancer. Because if they have a strong family history, then we want to be a bit more cautious and ask the patient to come back more regularly.
Right. I'm 54. I haven't gone for it yet, doctor. I have to admit. I'm
not
scared.
very uncomfortable because they just put you to sleep and then you're done. You
I don't know
literally
why.
don't feel anything.
Do they
I'm
put
just
you to
afraid.
sleep, or do they just sedate you?
Sedation.
It's
Sedation,
sedation.
yeah.
But you are asleep.
You are asleep,
You
so
won't
they
feel
put you to
anything.
sleep.
You won't feel pain.
And it
Yeah,
takes
you don't
what,
feel
20
anything.
How long?
minutes or
How long
something?
is it?
10, 20
minutes.
Yeah.
Really?
It's very quick.
It's very quick.
I go to you.
I think the only uncomfortable thing is the lead up to it. Is
Yes,
the
the
preparation for it,
preparation.
because
No,
you got to
I'm just
drink all
afraid
that
something
liquid.
has got to go up my ass, right?
Yes, 100%.
That's the thing. But
But it's so tiny. You will
No,
feel
and I'll be
nothing.
sleeping.
You'll be
Yes,
sleeping.
you'll be
You
asleep.
won't feel it.
You
For
won't
10
feel-
minutes only.
Unless you
Yeah.
want
10, 20
to
minutes.
be awake.
No, of course not. That's why I'm afraid.
No,
I'm
you're
afraid I'll feel something.
You don't feel it at all.
No, you're asleep.
How do
won't-
you know?
I've gone for a colonoscopy.
Oh, you went
yeah,
already?
Clearly, yeah.
When you turn 50.
No. I've been for it before. I think I
Oh.
went once, like when I was having my issues with hemorrhoids as well, and it's really it's over like that, and you don't feel a thing. Like I said, the only thing is the lead up, because you got to drink all this liquid.
Okay.
Yeah.
Yeah,
Okay,
that's the
Okay,
So what do I have to do? What,
Yeah,
what,
That's
what
explain
do I have
the,
to drink?
explain the
Yeah,
process.
so everyone
leading
will
up
know.
to
Yes,
the colonoscopy.
the preparation involves us cleansing our bowel first.
Okay.
We call that the preparation, and it means drinking a big chunk of laxatives. And after drinking that, you go into the bathroom something like 7 times, 8
Yeah.
times, 10 times. You'll be passing and clearing out all the stools until it's all
Nothing
clean out.
left. Yeah.
Until the last few times you are passing like plain water. It has to be totally clean, otherwise we can't see it accurately.
Okay.
Yeah.
Wow.
And that you do at home.
Oh,
Yeah,
that
do at home.
You do it
at home.
Yeah,
first,
you do
like
it
the
at
day
home.
before.
Coming up to traffic.
Okay.
Kiss 92 traffic.
On the TPE towards the SLE at the Yio Chu Kang Road exit, look out for a broken down vehicle. Other than that, it's the usual peak hour traffic. If you spot anything, it's 8855 0920.
Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Quah Hak Mien, General and Colorectal Surgeon from Gleneagles Hospital.
And we were talking about the process for a colonoscopy. So you take this
Doctor given
laxative.
laxative,
Yes.
and you do this at home.
Yes, we're at
Yes,
home.
and they tell you that you have to stay close to the toilet
Yes, very
because
correct.
it's a serious laxative.
But that's good one.
Right.
It is good.
No, but
I'm
that's
sure
good,
it
yeah.
feels good.
Yeah, you're clearing
You-
your bowels.
Right.
Yeah.
So that is done, and I presume, I mean, you said it could be 6, 7, 8, 9, 10 times.
Yes.
So let's say I take it on a Tuesday, then on the Wednesday I would go for the colonoscopy.
Yes.
Is that what we're saying?
Yes, so say you are doing it on a Wednesday morning, then
Right.
you start your preparation on Tuesday night.
Okay.
Yeah. So it's what is it? 12 hours or about?
Yeah, so for morning procedures, we will get the patients to start preparing the night
The
before.
night before.
Okay.
Okay.
If we do the colonoscopy in the afternoon, then you start preparing it early in the morning.
Morning.
Right.
on the same day.
Oh, so
that's better
so
then,
it's
I
within
think.
the same 24 hours.
Yes, within the same 24 hours.
Right.
yeah.
Take the day off and then go down.
In the afternoon.
Yeah. But when I get, let's say, to the hospital and you're about ready to, for me to have the colonoscopy, do I have to take a laxative again, like maybe one last time? or something?
No. You
No,
should be all clear up. Yeah.
Okay.
You will feel that you are empty completely.
And
by
you're
the time
fast
you're
as
done.
well.
Yeah, I
right?
was about to ask.
And you have to remain fasted, because
yeah.
you can't eat. Because if you eat, then it gets dirty again. Yeah.
But with all that, pooping and everything, wouldn't I be extremely dehydrated after the entire process?
Not really. You'll be tired, of course, but you won't be dehydrated.
Okay.
And anyway, it's only for a short while. Once we are done, you rest after the wearing off of the anesthesia. You can have something to eat and drink straight away.
But
Okay.
the anesthesia is lovely, though. You wake up and you're like, oh, I've had the best sleep on 20 minutes.
Yeah.
Yeah. It
Okay,
is.
It knocks you
then
out.
I will go.
Yeah,
okay,
no,
since-
it really, you don't feel anything, I promise you.
Okay.
Yeah, at all.
I'll
Yeah.
make an appointment with you, doctor. Okay. I mean, since we are familiar.
And, yeah, and you haven't had a colonoscopy after 50, so yeah, it's a good thing.
Have you gone?
I'm supposed to go.
Oh my goodness! Let's go together.
No, you haven't ever gone for a colonoscopy?
Hang on. Do you do couple colonoscopies?
They put you in the same room and everything.
Not at the same time. One after another, maybe.
Well, we can.
we can do
we
it together.
Make arrangements.
Sure.
Yeah.
Yeah,
It's highly recommended, right?
Yes, we recommend.
Dr. Quah, what is the name of your clinic?
My clinic.
Yeah.
I name it after myself. So it's
Dr. Quah
Quah
Hak
Clinic.
Mien.
Oh,
Colorectal
At
Center.
Gleneagles
At Gleneagles Medical Center.
Medical Center. Which floor are you on?
Level 7.
Level 7.
Level 7.
Okay.
Okay.
Fantastic.
Okay.
Well, thank you
cool.
very much, Dr. Quah. Before we let you go, would you like to maybe give out some advice to people who are kind of like me or have some reason for not going for their colonoscopy and they are above the age of 50?
So start thinking about it, because it's really important, and we believe colon cancer do not appear suddenly. They start from something small, like a little growth or little polyps, and when we do colonoscopy, we can take those out, excise them completely, and it's gone forever. So
Okay.
that little lump, that little growth will never grow bigger or turn cancerous.
Okay.
It's really important.
So
Early
after I go for
detection.
this colonoscopy, when do I have to go again? Do I have to go again?
So if it's all healthy and you don't have a family background of colon cancer,
Don't have.
you may not need to do it again for 10 years.
Oh, 10 years.
Yeah.
Wow.
Oh.
Okay.
Yeah, if you want to be cautious, want to be careful, then maybe you want to do it earlier at 5 years. But
Oh,
otherwise,
it's not a yearly thing.
no, you don't.
Oh, wow.
Unless there are issues, then
Okay.
Yeah,
we
yeah,
will
yeah.
recommend, hey, look, you need to come back earlier. Yeah, but otherwise, no.
Okay.
Wow.
That's good to know.
There you go. I mean, go once, and then if everything is good, you don't
You're
have to go
done.
back for the next 10 years.
Yeah.
And your mind is at rest. You're
Yeah.
at
Yes,
peace.
yes.
Okay.
Yeah.
Thank you very much, Dr. Quah, for coming in today. It's been a pleasure
Yes.
talking to you and seeing you again.
Yes, thanks.
Thank you so
Pleasure is
much.
mine too.
We've been speaking to Dr. Quah Hak Mien, General and Colorectal Surgeon from Gleneagles Hospital.
Thank you for tuning in to The Big Show's Good
Hello, we are back. Is anybody left here? Anyone here?
Yes, of
Hello?
course. Okay, so the reason why we're coming back is because, I was asking Angel like sometime back about the DJI Neo.
Neo. Neo.
Neo
Yeah.
that she has.
Yeah.
It sounded like too good to be true. Something so small. It's a drone, by the way.
Yeah.
And I wanted to use it, when I'm out golfing with my friends.
Yeah.
So, she very kindly put together, an introduction to the Neo.
Neo.
Yeah, that's right, Neo.
Yeah. I think the important thing is that if you are looking for a drone,
Yeah.
and you've never flown a drone, and I was looking for a drone. I was very intimidated by the bigger ones,
Yeah.
and the price, obviously. This is 100% something to start with. It's 100% like.
But to me, it just sounded like crazy.
Too good to be true,
because
right?
there's no controller and everything. Okay,
Yeah.
anyway.
Okay, let's play the video.
Okay.
Welcome back to my channel. Today I am very excited to share my latest gadget purchase. I'm filming this from my villa at the Conrad Koh Samui, which is where I tested my latest baby for the very first time. First, I need to say that this is not a sponsored post by DJI, although I really feel that it should be. Introducing DJI's newest drone, the DJI Neo. Now, this is also my first time using a drone of any sort. And if you're looking at buying your own drone, this is a very, very good start. Let me unbox it and show you what you get when you purchase the drone on its own. Now, I decided to purchase this set without the controller. It comes with one battery, which is this, and nothing else, basically. But there's also, of course, the charging wire, 2 extra propellers, a screwdriver, and the manual. But there's also the option to get the Fly More combo. Now that comes with a controller and 3 batteries. Now I know you must be asking yourself, how do you control the drone without a controller? That's the best part about the DJI Neo. You don't need anyone or anything to help you fly this. It takes off from the palm of your hand and lands on the palm of your hand when you're done. This is super light at just 135 grams. It is the lightest and most compact drone that DJI has produced to date. Now, for comparison, an iPhone 15 Pro weighs in at 186 grams. This is even lighter than your average banana. Now, before you use your DJI Neo, you need to activate it. And for this, you'll need to download the DJI Fly app from the Apple App Store. Now, if you're an Android user, the app will work with an Android 7 and up, which is a shame because the latest Android version is 14 and the DJI Fly is currently too old for the current Android OS. Now, I have found the same problem with my DJI Osmo Pocket 3. I can't download the DJI Mimo app to transfer and edit my content because I'm using an Android and it's the latest OS that I'm currently using is the 14. So I think that there might be an understanding between DJI and Apple to have their products only work really well with the Apple OS, because when you look on the box of the DJI Neo, you will also see here that it works really well with iMovie and Final Cut Pro X. So that is a sign to me. So once you've activated it with your DJI Fly app, it's ready to fly. You have to first remove this protective cover that protects the gimbal. All you have to do is one short press and then a long press. And you'll see the propellers go. And that basically means it's on. Now the default mode is the follow me mode. If you keep pressing this button,
Droney.
it goes to droney. Now droney is when it pulls away in front of you and goes a little bit higher and then comes back. So it will film one video going up, it'll stop and then take another video coming down, so you end up with 2 videos.
Circle.
The next one is circle. Circle basically means it circles you while you stand still, and it will stop after it makes a full circle.
Rocket.
Rocket is literally that. It goes straight up above you, films one video, and then comes straight down to film another video.
Spotlight.
Spotlight is when the DJI Neo will hover in one spot and you can just walk around it and it'll just follow you. Follow you as in it'll turn, not move.
Direction track.
Direction track is when the DJI Neo flies backwards and you can walk towards it.
Follow.
And then follow is when it follows you from behind. So all you basically do is hold it on your palm. Wrong way. All you basically do is hold it on your palm with the camera facing you, and you long press this mode button once you've chosen the mode that you like. You long press that, and the propellers will start, it'll count down, and then it will take off. That's it. Now to turn it off, you do basically the same as I did earlier. You press a short once, and then hold it down again. And it should turn off. There you go. I had a bit of a problem turning it off the first time because the instructions online are to hold it for 3 seconds long, but you need to do that short press and then the long press again. All in, it is a fabulous addition to any content creators kit. Now, even if you'd like to level up your family holiday videos, the DJI Neo is it. Just be mindful of local government and property drone rules and you'll be good to go. Thank you so much for watching my channel. Remember to subscribe, like, and share. I'll see you in the next one.
All right, well done.
Thank you.
That's quite something.
I've learned
Yeah.
so much. What is your channel called?
Angelique too.
Just that.
Yeah, well, I've named
On
it also
YouTube, huh?
La Mia Vita Dolce, but that's a bit complicated.
Who can remember
Yeah,
that?
exactly. So it's just Angelique Teo is what it is.
Lemire is in the thing you use for your face,
No,
is it?
no. La Mia Vita Dolce, which means my sweet life.
Oh,
Yeah,
Nice.
but it's
Okay.
just Angelique Teo if you want to look for it.
okay. Angelique.
Yeah.
You guys know how to spell Angelique.
Yeah,
no?
there you
Because,
go.
I mean,
It's on
most
the
of the time
screen.
it's like Angel.
No, it's
you
on
know.
the screen
It's
there.
on
That's
the
the
screen,
same
yeah.
as my YouTube channel, as my Instagram.
Yeah, they'll be
Angelique
spelling it. You know what I mean? If we didn't have it there, they'll be spelling
IK?
Angelick. Angelique Teo.
Oh my gosh, don't even start. In
Okay.
school, it was like that. Bye.
Bye.
Hey, everybody.